When you walk into a patient's room, you always need to make sure that you sanitize your hands. And then we're gonna grab some gloves. You'll introduce yourself to the parents and make sure they know you're gonna be the nurse for today or their nursing student. And then at the beginning of the shift, you always want to make sure that you replace their heart monitor leads and their oxygen sat probe. So we're gonna say this is a 5-month-old kid. You're gonna take your leads. We put white on the right side. So you're gonna put that on his chest. And then you do smoke over fire. So you're gonna do black, put those two at the top, and then you're going to do the red one right beneath the black. You're gonna find your cord that's for the heart monitor. Most of them will be color coordinated, but just so you know, red one goes in the middle, and then the black and white are gonna be on either side. We're gonna hook up their oxygen sat probe. With a baby this small, you might have to put it around the end of their foot, but most of the time we try to get it on their toe. But for the sake of this baby, we're gonna put it right here on his foot. I always try to put the thing on the bottom of their foot so it doesn't come off. And then you just get that wrapped around and plug them up. So usually with a kid, you want to start with the least invasive stuff first. You come in, take a look at them before you start touching them so they don't get upset. And blood pressure usually lasts because it bothers them. So we're going to get that hooked up, get it on their lower leg, and then we'll run it. This monitor will show you heart rate, oxygen, respirations, and then your blood pressure will populate here. So we'll run that. With a kid this age, you are going to take a rectal temp. So when you get your thermometer, red is going to be ones for rectal temps, and then your blue is going to be for oral and axillary. So make sure you grab the wrong one. You don't want to make that mistake. You're going to get your cover. You need to use some lube. I don't have any, but you'll lube it up, and then we're going to take a rectal temp with kids this age. So you'll lift the leg, find the butt, slip it in. You don't want to go too far. You don't want to perforate anything, but just get it enough where your wheel starts turning, and then you'll get your temperature. All right. When you get your first set of vitals and you do your first assessment, you want to get a good head-to-toe assessment so that you can have a good baseline for them. So we are going to listen to the patient and check their apical pulse. So you'll take the thing, listen. You can always use your thermometer to start a timer for yourself, and then you're going to listen for the full minute to get their heart rate. With a kid this age, we are going to be in the 100 to 180 heart rate for them. And then you're just going to go from head to toe and do your normal assessment. You will have different vital sign ranges based on their age. So you'll just look back at what Dr. Hand gives you to go by for those. After your initial assessment, we're going to round every 2 hours to check on a few things. So for one, we're going to check and see if they're in pain. Pain is known as the 5th vital sign. With a kid, we're 5 years old now too. They're able to tell you pretty much if they're hurting or not. But if it's a younger kid, if they're fussy, if they're, crying a lot, not able to sleep, if mom says that they're acting different, mom knows best, always. So just kind of be mindful of that. We're also gonna keep up with their respirations, cardiac. We're gonna watch their heart rate and document that every 2 hours as well. Another thing we're always gonna check every 2 hours is their IV. So you will, they can be saline locked, so make sure that the IV is flushing. Always make sure to get your air out, get an alcohol swab. We're gonna swab off the end of this. And if they're not hooked up to fluids, you need to be flushing their IV at the beginning of shift and probably at the end of shift too, just to make sure it's working all right. We're gonna look at the site through our dressing, make sure it's not tight or red or puffy. Give it a good feel. As long as it looks okay, then we'll monitor that every 2 hours as well. If they're on fluids, a kid this age at 5 years old is not going to necessarily need a Buretrough, but under the age of 3, we use a Buretrough for our kids. So that is special tubing that has this chamber that holds 150 mLs of fluids, and it's just to make sure that we're not overloading our kids. We want to adjust this every 2 hours as well. So With this kid, we're going to set his fluids up. His fluids are going to be at 42, so we're going to put double that amount in the Burtrough so that every 2 hours we're having to come and add a little bit more fluid to it. So we're going to get our tubing in here. We're going to unroll these clamps. You're going to select Pediatrics, and then we're going to do IV fluids. Most of these will probably already be going, but just in case you have to start some fluids or help your nurse, you're going to click primary bag, and then we're going to set them at 42. We'll double that amount, giving us 84, and that'll put it at 2 hours. So then we'll run that and make sure that, you know, we're hooked up and everything to our patient. So once that starts running, we'll be sure to check back in on it every 2 hours. Make sure that is going well, and then we'll refill this each time we reset the volume. Another thing you're going to be checking every 2 hours is safety. So we want to make sure the bed is in the lowest position. When we're done working, we want to be sure that we pull up our side rails, make sure the bed is locked, make sure it's in the lowest position, make sure mom or kid has the call light beside them so that they can call if they need anything. If your patient is on oxygen or if they have a history of seizures, we also want to make sure that we have suction in the room. This kid does not, so we don't have that set up, but in the case that we did, we would always want to have that at the bedside in case of an emergency.
All right, for your babies, you're going to give your antibiotics and certain medicines through a syringe pump. So your syringe will come filled with medicine. It'll have a sticker on it saying what it is, how much they're getting, what rate, and all of that good stuff. So we're going to hook it up to our syringe tubing. You're going to go ahead and just prime it until you get your drop at the end, and then we'll load it in here. So the way we load it, you pinch this little side piece down and pull it out. And then we're going to lift this piece and turn it around. This will situate right in here, and the edge of this will clip in right here. Then you're going to pinch this and put it back, and it'll grab onto the end of that syringe, and then we'll drop this and turn it on there. We'll take our tubing, wind it through these just to keep it in place, and then we'll hook this up to our fluids. So then your nurses will be here to help you through this, but we'll go through and select whatever we're giving. So in this case, we're going to be giving IV medications, number 4, antibiotics, and then from here, you'll have a list of antibiotics. So you can pick whatever medicine it's going to be. We'll do clindamycin. We'll say yes if that is what is on the sticker. It's saying it's incompatible, so we'll say yes. It's going to ask you what kind of syringe. This one is a BD, you can see here. So we'll select number 1. It's saying, is this a 30 ml syringe? And it is. So we'll confirm that. It'll ask you how much to weigh, so we'll say 8.9 for this. And this is in kilograms. We'll enter that. And then however many milligrams. On the sticker, it will let you know, yes, this is a 30-minute infusion. We'll click enter. Confirm all these settings that it's correct. We'll click yes. And then it's going to tell you to prime. So we've already got it all the way to the, through the tubing, so we're just going to prime a little bit to make sure there's no air in the tip of that. We're going to press that, press it again, and then we'll hold. It'll start lighting up green, and you'll see that it drips off the edge. We'll stop, exit. We'll hook this up to our patient, and then it'll say press this key to begin. We'll begin the infusion, and it will go, and then it will start beeping when it's done.
Every 4 hours, along with our vitals, we're also going to monitor their intake and output. Most of the patients are strict eyes and nose, so we're going to weigh our diapers. So we have a size 1 diaper in a bag here. So we're going to turn this on, and underneath here will be everything that you need. So we're going to grab a size 1, throw that on there, and the bag, throw that on there, and we're going to zero out the scale. So that's going to subtract out the stuff that is not the urine. So we'll take that off once it's zeroed out and put on our diaper, our wet diaper, and then it'll let us know that we're going to chart 104 for their output underneath diaper weight.